Every year brings another candle on the cake, and for women approaching their 40s and 50s, it may be time to take new steps to protect their health. SSM Health family medicine physician and wellness coach Dr. Roopa Shah has some advice and tips for women on managing their health. Now, Dr. Shah, what should women know about their health as they get older?
So, I can probably speak to this pretty well since I'm one of those approaching the
Much
big
better
5-0.
than I can.
Yes. So there are a few things that women do kind of notice as they age. One of the biggest questions I get in the office really is about menopause. This is that, you know, the change of life that happens between your 40s and 50s. A lot of symptoms occur, a lot of hot flashes, mood changes, memory problems, vaginal dryness, a lot of things that are difficult to talk about with your physician. But I really encourage women to talk to their physician because there are some treatments out there. For some women with really moderate to severe perimenopausal or menopausal symptoms, hormone replacement therapy can be a treatment. And if not that, then there's some other treatments that are out there that you can talk to your physician about.
Yeah, and kind of getting ahead of that, what are some of the key screenings that are important for women in that key range, 40s to 50s?
Yeah, so mammograms, that's the big one. And there is quite a bit of confusion around this because there's so many different screening guidelines out there, and it's hard to know which one to follow. Typically, I really advocate for starting at age 40 and getting mammograms yearly. However, again, you could start at 45 or 50, but it really depends on talking to your physician, your family history, your personal health history, and then deciding what's the best screening for you. Beyond mammograms, colonoscopies. Those guidelines have changed a number of years ago, and we now start at age 45. So do talk to your physician.
A little earlier
than we used to at age 50, but now it's age 45. So if you haven't had your colon cancer screening, talk to your physician whether you need a full colonoscopy versus maybe the Cologuard, which is our new screening test, which is fantastic. And don't forget about Pap smears. The guidelines have changed on that over the years too, so they're anywhere between 3 to 5 years, depending on whether you get the Pap plus the HPV and depending on your age. So again, talk to your physician about what is best for you, but do not forget those very important screening tests.
Yeah, and you know, with each age comes a different, you know, screening for sure. Good to have those all kind of mapped out right there.
Absolutely.
Now, what is some advice that you have for women who might be a little concerned with aging?
Sure. I think my biggest piece of advice is live clean. And when I say live clean, the biggest contributor to aging is the term, and I love this, it's inflammaging. It's all about inflammaging and how it affects your DNA at your cellular level, and it actually does age us. So inflammation in the body is, of course, all the things in our environment, but it's a lot of what you eat. So it's alcohol, it's sugar, it's processed food with those high omega-6s. So if we can limit the inflammation, we can live cleaner, and we can hopefully age a little bit more gracefully.
Wow, that's very interesting, very new, and I think that can go for everyone too, right?
Oh, absolutely, absolutely.
Very cool. All right, good tip there. Dr. Shah, where else can people find you?
They can find me on Instagram at Wellness with Dr. Shah.
All right, thank you as always.
Thank you.